Today I want to discuss chronic fatigue, something that's frequently overlooked and often misunderstood. Unfortunately, most of these people that are depressed, have fatigue, lack of motivation, they just get lumped into a low thyroid or hypothyroid category, and they're given thyroid medications for the rest of their life, and the underlying root issue never gets resolved. So we're going to talk about what we can do, how we can look at a little closer at more extensive labs, and through functional medicine, we can really apply some things to help these folks feel better. My name is Chris Jones. I'm the owner of Wellness Movement, a functional medicine clinic, and I work with people all across the United States to help them restore optimal health. You can find more information at drchrisjones.com. All right. So we've got to look at more than just TSH. Again, if TSH is lab high, meaning hypothyroidism, most of these folks are giving a thyroid hormone replacement such as Armour or levothyroxine. If you've been down this road, you realize that they typically just keep tweaking and adjusting the medication, or maybe trying a different thyroid hormone replacement. And maybe it helps for a little while, but it never really addresses the underlying root issues, which we'll talk more about in just a minute. When the thyroid replacement hormones don't help, what else can we do? Thankfully, there's more we can do. So I've talked about this before. This is a full thyroid panel. So instead of just looking at TSH, which doesn't really give us a good gauge of overall thyroid performance in the first place, we like to look at a full thyroid panel, which is 10 thyroid markers, and it paints a clearer picture as to where the underlying issue is. So, short thyroid hormone lesson: T4 and T3 both get made by the thyroid. T4 is inactive, T3 is active. But T4 must be converted into the active T3 in order for us to feel well and really receive the benefits of the thyroid hormone. The main place this T4 to T3 conversion happens is in the liver and the gut. Most Americans eating an inflammatory, what I call the standard American diet, SAD, standard American diet, it's SAD. Most of them are eating foods that are inflammatory, causing inflammation in the gut and liver on a chronic daily basis. So in order to help thyroid function, in order to help thyroid conversion to happen properly, we have to often look at the gut. This thyroid panel, again, can tell us where the problem is coming from. Is it looking like it's more of a conversion issue? Is the thyroid actually not producing enough T4 and T3 hormone? This full panel, again, 10 thyroid markers, can certainly paint a clearer picture. T3, reverse T3 is a great marker to show us if there is chronic stress that the person may be dealing with. This is absolutely going to raise cortisol levels and certainly make folks feel more sluggish and typically more difficult to lose weight. We also get to see TPO antibodies and thyroglobulin antibodies. These are the two thyroid markers that indicate whether or not the person has Hashimoto's. Research shows that over 90% of people with hypothyroidism end up with Hashimoto's. So it's really important to check the full panel, not just look at TSH. Again, if we just look at TSH and then we give somebody a hormone or a medication, we're never really getting to the root of the issue. So what else can be done? These other important labs are common issues that I've found working with hundreds of clients that must be addressed, and they're often overlooked when somebody has chronic fatigue. They just feel unmotivated, they have difficulty losing weight, they don't feel energized, they maybe don't sleep well, and these underlying issues can certainly play a role. So inflammation, if you're inflamed, if you're eating inflammatory foods, that must be fixed and addressed. C-reactive protein here is a great marker for inflammation in the body. If it's over 3, that is showing excess inflammation. We really like that number to be closer to 1 or 2. In this particular case, this person had a C-reactive protein of 19, which is crazy high, showing lots of inflammation. This will slow all processes in the body down. It will create inflammation of the brain. The thyroid conversion process won't happen as well. because the body's so inflamed. The gut is typically also inflamed as well. So a great marker to check. Most times you go to your doctor and get your yearly wellness checkup, that's not looked at. Other tests that are often overlooked is iron panels. I cannot tell you how many times, especially women, they're fatigued, they just don't have motivation, they're difficulty losing weight, dry skin, and their iron levels are low, but it's overlooked by the medical community. We've got to check iron levels. Something else I've discussed before is looking at labs from a functional medicine perspective, or what we call functional or optimal ranges, which is just a tighter, healthier range that we want to compare you to. We don't want to compare you to the sick population. We want to compare you to healthy individuals. And so through functional testing, we can better assess where your iron levels are at, where your inflammation levels are at, where your thyroid markers are at. And all of these go together to create health. It's never just one thing. So again, addressing chronic fatigue is certainly, the medical model just typically will give a thyroid medication, but we have to dive deeper, as you can see here, and address these underlying issues. Food, diet, what you're eating is absolutely important. If you're putting more fuel on the fire by eating inflammatory foods on a daily basis, this is going to exacerbate the fatigue. So really watching what you eat, being well advised on that is so important. We often have to support with supplementation to get these iron levels back to normal, to get the inflammation levels down where they need to be. Things like omega fish oils, things like turmeric, resveratrol, these are great at really reducing inflammation. So definitely some things that must be looked at, and that concludes for today. So again, chronic fatigue, you've got to dive deeper. If the thyroid medication or medication in general just isn't helping, it's good to reach out. Find a functional medicine practitioner that can dive a little deeper and help you understand where the underlying issues are coming from. Thanks a lot. If this has meant something to you, if it struck a chord with you, please like, tag, share a friend that you think may benefit from this. Have a great day.